Good morning. Shall we start? Hmm? Okay. Regarding platelets, the important functions which we started was platelet plug formation. That was a temporary hemostatic formation. Okay. Primary and secondary we have seen. Today we are going to cover mainly the secondary. This is the basic flow chart of platelet. Okay. The functions of platelet. These are the thrombocytes or platelets, RBCs, the regular vessel structure, okay, the smooth surfaces of endothelial cells, okay, which prevent the adherence of platelet to become activated and forms the platelet plug. So, if this smoothness of the endothelial lining goes, then what will happen? Clot formation takes place. What happens in atherosclerosis or the plug formation? There is covering of the cholesterol, so that changes the smooth surface of the endothelium lining into the rough surface, which stimulates the platelets to form the clot. Okay, this is the flow, and these are the various clotting factors. In blood we have the procoagulating factors and anticoagulating factors. Okay, the they are present in inactive form, but for clot formation they have to get converted into active form, and this conversion of inactive to active is in a sequence of events. So this reaction is known as cascade reaction. Clear? Why this is known as cascade? Because this is a sequence of events. Once the first step is stimulated, it will respond to the next final stage formation. It is a cascade of reaction. All the factors, all the proteins, okay, there are number of proteins. All these proteins are present in the blood, but they are present in inactive form unless the body requires for the formation of. Okay, so there is a balance between pro and anticoagulant factors. So when this balance gets disturbed, the clot formation takes place. Okay, this is the site of injury where there is vasoconstriction. You can see easily release of endothelin, if you remember, release of thromboxane A2, okay, and ADP. These are the chemicals or factors which are responsible for vasoconstriction as well as aggregation of platelets. Now remember another important thing, the role of von Willebrand factor. This comes here, okay, when the collagen is getting exposed. Okay, when the collagen gets exposed, the von Willebrand factor combined with the receptor present on the platelet, that is glycoprotein, okay, that is 1B. You have to remember the name of these things, 1B, 2B, 3A, okay. These are few basic important things that has to be remembered. इनका mechanism drugs के काम में आएगा, okay. So anti-drugs which will inhibit this formation or release of these factors, they will prevent the clot formation. Yeah, so these are the things you have to remember. If you remember with reflex, एक reflex की बात की थी अपन ने पिछली क्लास में, that was nerve reflex. Okay, some receptors were there which were responsible for generating the nerve reflex, which was responsible for vasoconstriction. So first step for hemostatic clot formation is vasoconstriction. Okay, formation we have seen. Platelet aggregation, okay. Now you remember, come fast, cytokine secreted by neutrophil monocyte platelets. Is there any role of RBCs in clot formation? ये सेम फेसेस है, रोज देखोगे बच्चे, 10 बजे बाद भी यही है बच्चे. Is there any role of RBCs, WBCs in clot formation? Yes or no? कोई बहुत बड़ा अभी यूनिवर्सिटी एग्जाम नहीं है, just yes, yes, they have a role in clot formation. Okay, primary hemostasis, remember these substances: ADP, thromboxane, platelet addition, von Willebrand factor, aggregation, recruitment. These now from where these substances are coming? They are coming from the platelet. So another important question related to this is structure of platelets. When we'll talk of structure of platelets, remember it's a this formation from the megakaryocyte. It does not have a nucleus, but it does have Golgi apparatus and mitochondria, zymogen granules, endoplasmic reticulum, open canalicular system and closed canalicular system, alpha granules and dense granules. Other than these, there is presence of actin and myosin. Plus, a special protein is present in the platelet, that is thrombosin. Okay, now these three proteins, actin, myosin, thrombosin, they are responsible for the contractile nature of platelet. Now, what is the role of this contractile nature of platelet? That comes in your clot retraction. Okay, actin, myosin, thrombosin, role of these contractile proteins कब आते हैं? जब clot retraction होगा. So first step is normal healthy vessel, balance is there between pro and anticoagulant. Okay, injury to the vessel or the tissue results into the formation of clot. So there is imbalance between these two factors resulting into the temporary hemostatic flux. If the vessel is minor, okay, that will inhibit or resist the flow of blood. Okay, in other cases it has to form a permanent clot. Okay, when it is to form permanent or definite plug, okay, that clot cannot be present in the circulatory system as such, that has to be removed. So for removal of the clot, first step is clot retraction. So responsible for clot retraction is actin and myosin plus thrombosin. So structure of platelet, that includes the function of platelet. Open canalicular system is a tunnel-like structure. So from the membrane of the platelet, internally the canaliculai are formed. So they gave a tunnel-shaped appearance. They are responsible for releasing the granules or the content which are present in the platelet. Closed canaliculai, they are present inside the cytoplasm of the platelet. Okay, mitochondria, role of mitochondria is ATP formation. Plus ATP, other than this ATP, it results into formation of ADP and release of thromboxane A2. Thromboxane A2 and ADP का क्या role था? Vasoconstriction or platelet aggregation. Another important constituent of platelet is 5-hydroxytryptamine or serotonin. Okay, so these are the contents which are getting released from different parts of the platelet. Dense granules, okay, it is a bigger granule, okay, when we are talking of alpha and dense, okay, so then dense granules, it is a bigger size granule, number of chemicals are present, but most importantly, it is responsible for storage of calcium. Okay, you have a table given in your book, contents for alpha granules, dense granules, open canalicular system, closed canalicular system, glycoproteins present and phospholipids which are present. So glycoproteins, they create a negative surface which repels the negative surface of the endothelium lining. So there is never attachment of platelet to the regular smooth surface of the vessel. Okay, so when question comes, write down the functions of platelet. It is not only the formation of clot or temporary hemostatic flux, you have to write down the different functions of different content or the structures which are present in platelet. Clear? Other than this, we have heparin, okay, present in the blood. Heparin sulfate is present, okay, its combination. So we'll see in an PPT. तो इसमें बोर मत होना, इसके बाद में जब 9:45 को मुझे बता देना, we'll have a small animation, because most important question comes regarding this coagulation mechanism is either you get a note on extrinsic coagulation mechanism or intrinsic mechanism of coagulation. Okay, when we are talking about that, you get two terms frequently in use, coagulation and clumping. So there is difference between coagulation and clumping. Coagulation, when we are concerned with platelets or clot formation. Okay, clumping, when we do the blood group determination. Clear? So it is a general tendency of students to answer it synonymously. Okay, but don't make this mistake of answering it in this way. So this is a series, involves a complex series of events. Okay. These are the different clotting factors. You can see the Roman numbers 1 to 13. okay, but absence of factor 6, okay. So वाइवा में सबसे ज़्यादा ये पूछा जाता है name factor 6. So factor 6, as such there is no factor 6, but you have to remember this: fibrinogen, prothrombin, tissue thromboplastin, calcium, labile factor. These factors you have to remember on tip. So there are total 13 coagulating factors. Both are present in inactive form. Okay, factor 6, as such there is no factor 6, so it is missing. So overall clotting factors कितने हो गए? 12 हो गए, पर नंबर इनको हमने The process of coagulation involves a cascade of reaction in which activation of one factor leads to the activation of next factors. It is divided into 3 steps: formation of prothrombin activator, formation of prothrombin to thrombin, and fibrinogen to fibrin. ठीक है, कौन सी 3 स्टेप्स हो गई? फर्स्ट स्टेप हो गई प्रोथ्रोम्बिन एक्टिवेटर, सेकंड क्या हो गई, थर्ड क्या हो गई, fibrinogen to fibrin. So for the first step to take place, that is prothrombin activator, there are 2 mechanisms given. One is intrinsic, the other is extrinsic. Clear? When we are talking of intrinsic, it is an elongated mechanism. Intrinsic means inside. Okay, so when there is an injury to the vessel and it gets exposed to the collagen, okay, so the factor 12 starts activating. Clear? इसमें आपको एक सीक्वेंस ऑफ इवेंट्स याद रखने, क्योंकि इसमें इंपॉर्टेंट क्वेश्चन आता है, या तो पूरा कोएगुलेटिंग मैकेनिज्म आएगा या एक्सक्लूसिव इंट्रिंसिक और एक्सट्रिंसिक. So when we are talking of intrinsic mechanism, it is an elongated mechanism. So it will require more factors to keep or to remember in your mind. Okay. Story of intrinsic mechanism is when there is injury or trauma to the blood itself or to the vessel. Okay. When we are talking of intrinsic, there is involvement of platelet. So that will help us to remember the intrinsic mechanism starts with factor 12. That factor has to get activated. ठीक है, ये क्यों नहीं एक्टिव रहते हैं? क्योंकि थ्रोम्बोमोडुलिन के साथ में ये कंबाइन कर जाते हैं और ये जितने भी फैक्टर्स ब्लड में सर्कुलेट हो रहे हैं ना, इनको इनएक्टिव रखते हैं, इनको इनहिबिट करते हैं एक्टिव होने से. बट जब स्मूथनेस, नेगेटिव सरफेस, exposed to collagen, all these factors have taken place, what will happen? The factor 12 will get activated. Now how this factor 12 gets activated? With the help of high molecular weight kilinogens, और भी 2-3 केमिकल्स होते हैं जिनकी हेल्प से ये एक्टिवेट होगा. बट स्टोरी कहाँ से स्टार्ट होगी? फैक्टर 12 से. So factor 12 will get activated. This will ask or stimulate or affect the platelet, okay, to release the different factors and activate them in a sequence of events. So 12 to 11, 11 to 9, 9 to 10. तो कौन कौन से हमने मिस किए? 12 to 11, 11 to 9, 9 to 10. Okay, 10 is Stewart power factor. That 10 factor is common for intrinsic and extrinsic. Clear? The story for intrinsic mechanism starts with factor 12, 12 to 11, 11 to 9, 9 to 10. In between, there are a number of factors which are acting as cofactors or supporting factors which will help to follow the cascade or the events taking place in clot formation. This we'll see in flow chart. But to remember, to make it easy, intrinsic mechanism, concerned with platelet, concerned with factor 12. Clear? So when we are taking blood on a pipette, in a pipette, okay, अपन कहते हैं ना pipette में blood suck कर लो फटाफट and just use it, otherwise it will get clot. So which mechanism there will be acting? Intrinsic mechanism will take place. Clear? उसका जो wettable surface है ना tube का, okay, that will stimulate and release the factor 12, then will affect the platelet, release different chemicals, and then the following mechanism takes place, leading to the formation of prothrombin activator. Clear? जब अपन एक्सट्रिंसिक मैकेनिज्म की बात करते हैं, आउटसाइड. So when there is release of tissue factor or tissue thromboplastin, tissue factor, that is factor 3. Okay, so whenever there is injury, damage to the tissue, this factor will be released. When this factor released, okay, this is going to activate the factor 7. 3 किसको एक्टिवेट कर रहा है? 7 को. 3 plus 7 कितना होता है? 10. तो फाइनल पाथवे हमारा क्या आ गया? 10. तो रिमेंबर एक्सट्रिंसिक के अंदर केवल 2 चीजें इंपॉर्टेंट है, 3 and 7. So the combination of 3 and 7 results into the activation of factor 10. So 10 gets activated with the help of 2 important factors which are having important role in extrinsic mechanism of clotting. ये केवल एक निमोनिक टाइप का याद करने का है कि आपका एक्सट्रिंसिक है और इंट्रिंसिक है. कॉमन पाथवे अपना कहाँ जाके आएगा? प्रोथ्रोम्बिन एक्टिवेटर एंड फॉर लेटर स्टेजेस. But this is a basic idea. Along with this, you will be requiring 4 factors that we see in flow. Okay, and all these factors, they are present in blood, but they are present as such normally in inactive form until unless there is requirement for the clot formation to take place. So don't get so much lethargic और बोर होने की जरूरत नहीं. इसके ऊपर 10 नंबर का क्वेश्चन यूनिवर्सिटी तक पक्का है. Not only in semester, but in your university exam. Okay. If it passes or more injury to the blood vessel or the extravascular tissue, release of factor 3, lipoprotein and phospholipid mixture. This is the combination of lipoprotein and phospholipid mixture. Okay, viewed as extrinsic to circulating blood. This is viewed as extrinsic to the circulating blood. So the mechanism becomes extrinsic mechanism of clotting. Activation of factor 10 to 10A with 3 with factor 7 forms a complex. So 3 is responsible for the activation of 7 and combination of 3 and 7 results into the activation of 10 to 10A. Okay, which forms a complex in presence of calcium. Calcium is factor 4. Okay, activates factor 10. Formation of prothrombin activator activated factor 10 with phospholipid factor 5 calcium factor 4 forms a complex which is called prothrombin activator. क्या हुआ? सोई नहीं रात को? नहीं सर? चलो बाहर जाके मुंह धो के आ जाओ. Okay, intrinsic pathway. Intrinsic pathway begins in the blood itself following trauma to the blood itself or exposure of blood to collagen. Okay, activation of factor. अगर किसी को बहुत अच्छे से समझ में आ चुका है तो वो जा सकता है क्लास में. Activation of factor 12, trauma to the blood releases. Okay, and this gets activated. A shows the activated nature of the factor. Platelet also activated by exposure. Caused by फिर उसके बाद में sequence है 11, 9 and then finally the conversion of 10 to 10A. Okay, this is again in presence of factor 8, calcium and phospholipids. Okay, calcium factor 4, 8 and 4. After the formation of prothrombin activator, okay, next step is thrombin and fibrin. Clear? Fibrin is 1. ठीक है. So 10 के बाद में आ जाएगा 5 factor. Combination with the 5 resulting into the formation of factor 2. Activation of factor 2. So 10, 5, 2, 1. Clear? The sequence becomes 10, 5, 2, 1. So easy to remember at least. So when there is a question that asks, that is write down the clotting mechanism, okay, in all. So you have to give your answer in a flow chart. So the sequence should be correct, okay, and their cofactors has to be there. So factor 8, factor 4, okay, factor 8 is responsible for, this is the intrinsic pathway, Okay, 12 to 11, 11 to 9, 9 to 10A. Okay, prothrombin getting converted into prothrombin activator. Tissue factor, that is the extrinsic pathway. Okay, factor 3 plus 7, that gives you 10. 10 finally results into thrombin. Okay, 5, 10, 5, 2, 1. Then in presence of thrombin, the fibrinogen. Now this fibrinogen is a plasma protein which is present in the blood, but it is present in the soluble form. So if it is present in the soluble form, it will not be of great help for the clot formation. So this form gets converted into insoluble form in the form of fibrin. Clear? And then monomers of fibrin, they bind together. Okay, with the help of another protein present in the blood. So you have tons of proteins, so don't worry, you have to remember only few, 10 or 20 you have to remember. Okay, but you have tons of proteins present in the blood, but regarding coagulation you have to remember only these things, and with the easy sequence I have given you the idea how to remember and differentiate the intrinsic and extrinsic mechanism of coagulation or clotting. Conversion of prothrombin to thrombin is caused with the presence of calcium. So you can see the role of calcium, because when we will do anticoagulant, okay, there is important role of calcium. Okay, so for the final conversion of fibrin formation, we require factor 4, we require factor 8, we require factor 7, we require factor 9. Okay, so some of these basic clotting factors, they are getting formed from the liver. What is the source of formation of these certain 4 or 5 important clotting factors? The source is liver in the presence of vitamin K. So if there is deficiency of vitamin K, okay, or there is some problem in the liver, the formation of the clotting factors will get affected. For the final step to take place, that is the fibrin formation, these factors are must. So deficiency of either vitamin K may result into the bleeding disorders. So the mechanism has to be clear, so that you can apply your logical thinking. So why this particular scenario is given, that the level of vitamin K is low in the particular subject or the patient. So case scenario, you have to emphasize the different things कि ये story है और ये sequence of events है, तो ये क्यों emphasize किया गया है, ये question किससे concerned है, whether it is concerned with immunity, whether it is concerned with anemia, whether it is concerned with polycythemia, whether the problem is concerned with clotting mechanism. Okay, so each and every step you have to write down and pinpoint it, so you can come to a final conclusion. Okay. Also activates protein C. So now the role of protein C and protein F will come in fibrinolysis. Okay, so just remember, it also activates protein C. Positive feedback role of thrombin. It accelerates the rate of formation of prothrombin activator by the activating factor 8, 5 and 12. What do you mean by positive feedback? Another example of positive feedback mechanism? Yes, you. Second last one. Positive feedback mechanism का सबसे important example क्या है? Parturition. सही है? That was सही है parturition, पर इसके अलावा कौन सा है अगर अपने पास में आ जाए, तो ये भी एक पॉजिटिव फीडबैक मैकेनिज्म है बॉडी के अंदर. क्लियर? But that has a beneficial role. Parturition has a beneficial role. Clear? Polymerization is combination of monomer fibrins and getting convert it into meshwork of fibrin threads. Okay, because threads are not cross-linked with each other. Initially, the clot is weak because threads are not cross-linked with each other. Now, this is the picture which you have to answer in your copy. Okay, membrane phospholipids releasing tissue factor. Tissue factor की बात कर रहे हैं तो कौन सा mechanism हो गया? Extrinsic. Okay, in presence of calcium, that is involvement of factor 4. Converts factor 7 into active form. So tissue factor, that is the extrinsic pathway, but it involves other cofactors also. In presence of all this complex, it leads to the conversion of factor 7 into active form of factor 10. Okay, factor 9 इसकी भी रिक्वायरमेंट है, ये डायरेक्ट प्रोथ्रोम्बिन एक्टिवेटर को भी कन्वर्ट कर सकता है एक्टिव फॉर्म में. ओके, और इसका सेकंड रोल कहाँ पे आ रहा है? इंट्रिंसिक मैकेनिज्म में फॉर द कन्वर्जन फ्रॉम 11 to 9, वहाँ पे भी यूज में हो रहा है और इसका एक डायरेक्ट एक्शन भी है. सो इट इज नॉट ब्रॉडली वी कैन कैटेगराइज इट. ओके, बट दे हैव नंबर ऑफ फंक्शंस इन्वॉल्व्ड एंड दे हैव नंबर ऑफ कोफैक्टर्स प्लेस्ड ओवर हियर. ओके, सो फैक्टर 11, high molecular weight kininogen. So HMWK, in some books it's written HMWK, high molecular weight kininogen. Okay, in presence of calcium and precalciferin and negative charge surface. Okay, so this results into the conversion of factor 8 into activated factor. अब activated factor क्या करेगा? ये precalciferin को भी activate करेगा और factor 12 को भी activate करेगा. So conversion of into calciferin plus activation of factor 12 into another activated form. So accelerate the reaction. It will accelerate the reaction plus it will help into the conversion of precalciferin. Okay, activated factor 12 in presence of factor 9. Okay, convert into active factor. This factor directly can affect and indirectly it can also affect. Factor 5, it is coming into this picture. 10 के बाद में क्या था? 5, 5 के बाद में क्या था? 2, 2 के बाद में 1. Okay, so activated factor 13, fibrin stabilizing factor, which will be responsible for the cross-linked fibrin. Okay, this is the final clot formation. तो हमें क्या आंसर चाहिए आप में से? This is the flow chart which is required. No other subjective information. The only thing which is required along with this flow chart is number of clotting factors and their name. ठीक है? Factor 1, this 2, this 3. So you have to draw this flow chart. Addition to this, you have to write down the number of clotting factors, their Roman number and their particular name which is given. Clear? आप किसी भी बुक से पढ़ो, the flow chart remains the same. Now once this is getting formed, cross-linked polymer fibrin, the clot has to be retracted. The vessel has to get repaired. Okay, the vessel has damaged, the endothelium has damaged. Now it has to repair. So for the repair or correction of this vessel, okay, the platelet comes into action and it tries to pull the two margins of the damaged endothelium close together. So when they are trying to pull this vessel, damaged vessel, the platelet will contract, try to bring the things together. So this activation of contractile proteins takes place, actin, myosin, thrombosin, and this, along with this, it will release two important factors, that is platelet derived growth factor and vascular endothelium growth factor. कहाँ से आ रहे हैं? Platelet derived growth factor PDGF, vascular endothelium growth factor. Both these factors, they are essential for the repair of the damaged or the injured vessel wall. When this damage or the repair has been done, along with this repair, there is clot retraction. The clot cannot permanently reside in the vessel. It has to be broken down, lysed and removed from the circulation. Okay, so for removal of this clot has retracted. Okay, now it has to be removed. So for removal, it has to be broken down into small particles so that it can be removed. For removal of this, we already have a protein present in the blood that is known as कौन सा होगा? Plasminogen. Okay, normally this plasminogen is present in inactive form. Okay, so this gets converted into active form, and now this is a fibrin loving protein. So what it will do, it will eat all the fibrin, जो fibrin threads बने ना, it will attack on that particular meshwork, network of this fibrin thread, dissolve, break these, okay, and it will be finally removed from the vessel. So this mechanism is known as fibrinolysis, and this fibrinolysis mechanism takes place due to the presence of plasminogen. So if there is a clot, okay, formation, so immediate action which has to be taken is the activation of plasminogen, which will be responsible for breakdown fibrinolysis. So can it be applied clinically? In drugs, it has to be. Okay, so if there is any kind of stroke, ischemia, myocardial ischemia, okay, so these drugs, they are given. Okay, so the drugs which will activate plasminogen. ठीक है, तो अपन जब वीडियो देखेंगे ना तो उसमें ड्रग्स का भी शायद रोल आएगा, तो उन ड्रग्स को अपने को कोरिलेट करना है. वो वेस्कुलर स्पैज्म में काम आ रही है, टेम्परेरी हीमोस्टैटिक प्लग फॉर्मेशन में काम आ रही है, या क्लॉट फॉर्मेशन में काम आ रही है, या फिब्रिनोलाइटिक मैकेनिज्म पे वर्क. ठीक है, हर स्टेप के लिए जो डिफरेंट मेडिसिन है वो यूज आती हैं. एस्प्रिन आपने सुना ही है, क्या मैकेनिज्म है? ब्लड थिनिंग कर रहा था, वो साइक्लोऑक्सीनेजेंस एक एंजाइम है, उसके ऊपर इफेक्ट करता है और फिर वो क्लॉटिंग फैक्टर के ऊपर इफेक्ट करता है. तो हमें वो मैकेनिज्म पता होना चाहिए कि पर्टिकुलर ड्रग कहाँ पे क्यों एक्ट कर रही है और क्या मैकेनिज्म है. उस मैकेनिज्म को समझने के लिए हमको उसका मॉलिक्यूलर लेवल जो होता है ना, स्ट्रक्चरल लेवल, व्हाई वी आर स्टडीइंग द स्ट्रक्चर ऑफ प्लेटलेट्स, because we are concerned that the outer layer is made up of glycolipids, phospholipids. These are the certain receptors which are present. Glycoprotein second B is responsible, then glycoprotein 3A, 3B is more important for aggregation and addition. Okay, thromboxane A to serotonin, they are responsible for vasoconstriction. So we have to have the functions plus the presence of the content in platelet. So platelet बहुत छोटा है पर बहुत important. How the shape of platelet is maintained, this because of the cytoskeleton created, okay, by this proteins, actin, myosin, thrombosin, okay, and other than this there are different proteins which are present which will be responsible for maintaining its shape. So first step, if you remember, in temporary hemostatic flushes there is enlargement in the size of the platelet for the formation of temporary hemostatic flux. Okay. Urokinase, streptokinase is responsible for the conversion of plasminogen into plasmin. So what are the cofactors responsible is these: urokinase, streptokinase, okay, and plasmin gets converted, and plasmin finally responsible for degradation of fibrin because it is a fibrin loving plasma protein. Okay, hemostasis, tissue factor, neural, primary hemostatic flux, blood vessel injury, this is the story. Okay. Once you know the normal mechanism, then we can apply it. Whether there is problem in the structure of platelet, whether there is decrease or increase in the platelet count. So what will happen if there is decrease in the platelet count? Okay, so the structure of the platelet is normal, but the count is below normal. What happens if the count is normal, but the structure of the platelet is not normal, or the content of the platelet is not normal? So the scenario gets changed. Clot retraction. Within a few minutes after a clot is formed, it begins to contract and squeeze out most of the fluid called serum. So once we are asking you to continuously do the practical, don't leave the blood in the pipette, okay? It will clot. So after some time you will see there is separation of serum because we have not added anticoagulant to that blood sample. So it will result into the serum. Platelets are essential for clot retraction itself. So function of platelet is role in clot retraction. Okay, it retracts 40% of its original volume. Role of calcium in coagulation required for the conversion in two steps in intrinsic pathway or reaction. So इसका कहाँ role आएगा? If we have to store the blood, because if we are going to store the blood as such, okay, it is going to get coagulated. So if it has to store, okay, the calcium, the chelating agent will be added and the calcium will be removed. So there will be no step. So we can hasten the clotting mechanism. We can store the blood. Okay, EDTA. Have you heard with this one? Okay, so it is an anticoagulant. If we have to keep the sample, we keep the sample in a EDTA vial. Okay, so ethylene ditetramine, it is often acting as a anticoagulant. An example of calcium is oxalate. Role of vitamin K, liver and vascular wall in hemostasis. Vitamin K required for prothrombin factor 7, 9, 10. Okay, कौन-कौन से factors के लिए responsible है? 7, 9, 10 and heparin itself. Okay, synthesize these factors. Removes activated procoagulants, synthesize anticoagulants like heparin, antithrombin C and C. Played by endothelium, semi-endothelium and vascular smooth. So ये अगर vitamin K की वैसे तो deficiency होना बहुत rare है, okay? But if there is deficiency of vitamin K, that may result into the bleeding disorder. Why circulating blood does not clot? Because of the velocity of circulation, endothelium smoothness, and this repels negative surface. Intact endothelium acts as a barrier between the subendothelial collagenous tissue and the blood. Circulating anticoagulants, natural anticoagulants कौन-कौन से हैं? Heparin, protein C and antithrombin 3. Okay, MCQ question. Fibrinolytic mechanism, protein C along with its cofactor protein S inactivates factor 5, 7. जब तक कि clotting mechanism के factors को inactivate नहीं किया जाएगा, ये mechanism help नहीं करेगा और इनको कौन inactivate कर रहा है? Protein C and protein S. Okay, inactivating these factors and tissue plasminogen activator increases plasmin formation. So this audio is not available, okay? So if the audio is available, okay, just listen to it, and if it is not available, just visualize the video. Is there any need to talk? It is just to make the thing easy for you to understand. Audio visual has a much greater impact, okay? Platelets, we'll do platelet count. Right now we are doing RBC count. Okay, then we'll do platelet count. What is the range of platelet count? 1.5 to 4 lakhs cells per cubic millimeter of blood. Okay. What do you mean by thrombocytopenia? Penia means decrease. Thrombocytosis, increase. Okay. What are the pathological conditions in which there can be decrease in the platelet count? सही बोले थे, घबरा क्यों गए? If there is hypofunctioning of bone marrow, definitely there will be effect on hemopoiesis, so there will be decrease in the platelet count. Other than this, there are certain viral infections also.
Hemostasis is the normal physiological response to limit blood loss after vascular injury. Blood clots are made up of activated platelets, red blood cells and fibrin, which hold the clot together. The process is mediated by around 30 proteins, which are known as clotting factors. Platelet activation and aggregation begins when vascular injury exposes collagen and von Willebrand factor from within the vessel wall to the blood. Platelets adhere to these proteins and become partially activated, changing shape and releasing signaling molecules which recruit more platelets to the site. At the same time, a protein called tissue factor triggers initiation of the coagulation cascade, the process that leads to full activation of platelets and the generation of fibrin and clot formation. Vascular injury causes tissue factor on the outside of cells in the vessel wall to come into contact with factor 7A and factor 10A in the blood, leading to the production of a small amount of thrombin. This thrombin fully activates platelets and triggers a cascade of clotting factors that activate each other, culminating in factor 10A mediated generation of a larger burst of thrombin production on the platelet surface. One molecule of factor 10A leads to the formation of 1,000 molecules of thrombin. Thrombin converts the soluble protein fibrinogen into insoluble fibrin strands at the site of vessel injury, while at the same time activating factor 13 protein to cross-link the fibers. The fibrin mesh stabilizes the clot and traps more platelets and red blood cells, facilitating its growth. In normal physiological conditions, the process of clot breakdown or fibrinolysis begins as the structural integrity of the vessel wall is restored. Endothelial cells begin to secrete a protein called tissue plasminogen activator, which activates the protease plasmin to degrade fibrin, dismantling the structure of the clot and restoring the integrity of the vessel.
Need to repeat? Over?
The process.
So it's over?